Oh, we are live. Hello, hello, hello. Good morning and afternoon. Good morning, USA. Isn't that? I feel like that's. Good morning, San Diego. That's definitely a movie.
Yeah.
And good morning, or good afternoon to everybody in the UK who's not in San Diego.
And we're
Yeah.
just about to hit afternoon on the East Coast. So,
Okay. Yeah. So you're 5 hours, aren't you? So yeah,
yeah,
just about to turn 12 o'clock.
that's right.
Perfect.
Lunchtime.
Um, and yeah, and I can imagine in San Diego, it actually probably is the morning, a couple of hours
Yeah.
before as well.
Yeah.
There you go. So, um, hello, everybody. If you're here and you are watching already and you're nice and early, please say hello in the comments, just so we know that we're talking to somebody. Doesn't matter if not, because we will fill this space with loads of good information. If you have any questions, please don't be scared to ask. Makes my life as the host a lot easier. But I've got a load of questions to ask anyway. So yeah, Bridget, it's lovely to have you here.
It's great to be here.
Woo, woo, woo.
Yeah.
Um, yeah, it's interesting. I'm actually really interested to see what the feedback is on this, because obviously being in the UK, talking about well-being,
Yeah.
and then having an American-based organization doing it slightly different, and looking maybe with a different culture is going to be
Yeah.
interesting as well, right? So I think
Right.
that's going to be interesting to see what comes out of that, and I'm really excited to see how this goes.
Me too.
And what people in the UK can learn, and maybe what we can teach you. I mean, I'm not going to be saying much, but you know what I mean.
Yeah. But still, I think there is certainly learnings both in both directions for sure.
100%.
Yeah.
Hi, Sarah. Sarah, can you see this, by the way? Bridget, can you see the people commenting?
Oh, let me see. Uh,
I know you're on your phone. You might not be able to see people
yeah.
commenting. That's right.
I'm
Well,
trying. Oh,
I
I
think
can
what I
now.
can do.
I fixed it. I got it.
Okay,
Yeah.
lovely.
Hi,
You can see this.
Sarah. I know
There you go.
Sarah.
There you go. Brilliant. Look, we'll get started. Because obviously this is being recorded and it goes onto podcasts like that. It goes onto Spotify, very unedited and very raw. So the
Okay.
more I mumble, the more people are going to switch off. Anyway, so welcome everybody. Thank you for joining us. If you're here already, I'm really excited for this episode on supporting leadership in the US public health with Bridget. I'm not Bridget. I can't say your last name. I forgot.
It's
There's a
okay.
special guest there, so I'm going to let you do that in your introduction.
Okay. No
Very
problem.
honest, very raw. There's no point pussyfooting around it. But yeah, it's gonna be really interesting, as I said. But yeah, let me do my introduction, get that out of the way, and then I'm going to ask you to share a little bit more about who you are, what you do, etc. So, for everybody who doesn't know who I am, my name is Rich. I am a high performance executive coach, leadership development or leadership performance trainer, an educator, and well-being coach. I'm also the founder of Employees Health, which is a workplace well-being company who educates and supports organizations in how they can support their employees thrive. That's kind of my intro done, nice and simple. Bridget, give me a quick intro, okay? And then I'm going to ask you about how you've got to where you are today, okay? So intro
Okay.
first, and then I'll ask the follow-up afterwards.
Okay. Sounds great. Hi. So it's Bridgette McCullough.
There you go. You okay? I got it wrong the last time we spoke, didn't I? Do you remember?
Yeah, it's totally fine. It's not an easy one. And hello, everyone. So, my name is Bridgette McCullough. I am a leadership development advisor with a healthcare system in Ohio called OhioHealth. My background is public health, corporate wellness, and well-being, which I'm sure we'll dig into a little bit more, and what led me into leadership development. But my passion is all around creating employee experiences, cultures that allow people to thrive, both in work and outside of work as well.
Love it. Very similar kind of passions, I guess, right? This is why I'm
Mhm.
excited for this topic.
Yeah.
So tell me, how did you get to where you are today?
Yeah, good question. I have a master's in public health, and really got started more. I'm a registered dietitian by trade, so I got started much more into my work in like the corporate wellness well-being space, the way that you would traditionally think about it, where you're really helping individuals to take care of their own personal health. And the more I worked with a variety of different companies and different industries, different sizes, it became very apparent to me that what needed more work was, or at least needed to be part of the strategy, part of the equation, was looking at how work itself and the behaviors and the policies and the practices and the culture was influencing people's well being. And honestly, their ability to take care of their own personal health. Started digging more into the research and seeing the influence that our workplace environment was having on our health, mental health, and physical health, and just became really passionate about that. And so um, I was working for a division in our company that actually served external employers. We functioned more like a vendor.
Mhm.
And I got connected with our internal leadership academy, which is where I work now. So that's our internal leadership development team that's focused on our own leaders and supporting and developing them. And I loved what they were doing. They were so focused on creating human centered leaders that were supporting the well being of people, even though they weren't really quite talking about it that way, but it was what they were doing. And I wanted to take that to our clients, to other employers, because I thought what we were doing was so impactful. And as luck would have it, I was able to actually take on a role on that team where I am helping to support and develop our own leaders, but then also have a part of my role where I am supporting external employers in doing the same. Because again, we've seen success with it. And so if you think about a healthcare system, our mission is to improve the health of those we serve. And I see this as an extension of our mission. We need to be allowing people to leave work well, not harmed, and being well suited to go home and take the best possible care that they can of their families, to be able to show up that they want to for their families, for their friends, for the people that they're interacting with, and just really thrive. Again, not just in support of the work, though that certainly matters, especially in healthcare. We are serving patients and their health and well-being, but also being able to take that home as well. So it's become kind of my soapbox. You don't really think about leadership development as public health. I don't think a lot of people do, but I do. That's why I'm doing this work.
Yeah, I love it. And it's such, like as you said, passion led. And I think it leads really nicely onto my kind of first question around what is leadership in public health, and what are the responsibilities they have, and the way that the way you see it from your side.
Yeah. So I think, again, I think it's for healthcare specifically, it's really imperative that we are supporting our and developing our leaders to take the best possible care of their people so that we can take the best possible care of patients. So the way that we talk about it at Ohio Health, we call it it's human-centered leadership.
Mhm.
So we tend to think about healthcare, and I think in other industries you talk about customer first, and in healthcare it's like it's always patient first, which of course that's true, but we can't really take the best possible care of our patients if we're not taking care of each other. And so the leadership skills and behaviors that we're working with our leaders on are very focused on creating positive relationships. So we're talking about emotional intelligence and empathy and being flexible and being courageous and creating psychological safety and building trust and a lot of these real human skills that are important for any relationship but are particularly important for leaders because they have a bigger impact and influence, and also people model what they do. So you're looking to your leaders for how to behave. When you see what they do, then you're going to emulate that. And then also, we know that if leaders are not well supported, if they're struggling, that's going to have an impact on teams as well. So for us, it's just become an absolute imperative that we really pour into our leaders and make sure that they feel well supported to be able to be successful in their role. And being successful in their role means that they're having a positive impact on the well-being of their teams. And oh, by the way, driving great outcomes for the organization, retaining people, keeping people engaged, all the things that organizations want to see too.
Yeah, 100%. Before I guess I kind of dive into that, it'd be good to understand, because I don't think, unless you know Ohio Health, you probably don't understand the scale of all of this.
Yeah.
And so to paint a picture for all the great things you just said and how that, because leadership for some is okay, 10 people.
Right.
But
Oh, yeah.
Ohio
Good
Health is
point.
what, 35,000 people, right?
Yes, good
Plus.
point. And it was funny to me when we talked first, Rich, that you know, I'm used to our big giant country. And so to me, our organization is about 35,000 people. It's growing too. So we're headquartered in the central part of the state, but our footprint kind of extends out. But it's exclusively in Ohio. So I think when I told you that you're like 35,000 people, that's a big company, and it's just one state. There are certainly other healthcare organizations in our country that go, have multiple states that they work with. But we are quite large. So when we talk about our leaders, I think it's roughly about 1,700 that are manager level and above. But we also are supporting supervisors, team leaders that are not included in that number. And then there's also work that we do for what we call emerging leaders. So people who are interested in coming into leadership, but don't actually have that in their title yet. And so we have some programs and initiatives for them as well. I always say that it's very important to start talking about these things, getting people to understand what we mean when we talk about what leadership looks like for Ohio Health and what it means to be a good leader well before somebody is being put into that role for the first time. And so often that is not the case. It's like, oh, you're really good at your job, so we're going to promote you to leader. But that's a completely different job. It's a completely different set of skills. And if you haven't been given any sort of training or even just having the language about what that looks like or what that means, it can be a really big jump to go from being really great at your job to being put into a role as leader. You're not doing that work anymore. You're doing completely different type of work. And so, yeah, we're trying to work with people as early as we can, as soon as they have any sort of interest in being a leader with our organization to make sure that we're starting to give them those skills.
Yeah, 100%. It sounds great. And I think just to paint a picture for the people in the UK, the way I understood Ohio Health is kind of a NHS for Ohio, but a funded one, and there's a few different options of that, right?
Yeah. So, I mean, we have hospitals, we have primary care, like doctors' offices. Like I said, we have a division that goes out and works in employers, like we do on-site clinics and physicals and fitness centers and things like that. We have clinics that are devoted, we call them work health clinics, where people can come to them if they're in contract with their employer to be able to do that. I mean, there's just so many different community work that we're doing. I mean, huge. We do so much as a healthcare system. Yeah.
And I guess the reason why I'm kind of bringing that for people's understanding is that means the role of a leader and the different types of leader you're going to have and the way you manage people is going to change
Yes.
tremendously, right?
Yes, and that's a really good point as well. Absolutely. So, most of our leaders, or a good portion of them, are clinical leaders. They are going to be, frontline. But then we have a corporate office, a pretty large one where I work. So you're going to have that environment. You're going to have people that are out in the field. I mean, it's a lot of variability in the different types of leaders that we have. And so, one thing to kind of call out for that, that I think is important, is that not only is my team facilitating programs and sessions with leaders, and we're trained as executive coaches, doing coaching with them. We also train leaders anywhere in the system that want to help facilitate what we do or to become a leadership coach, because we need that experience in the conversation. I don't have a clinical background, so I can't speak to that experience the way that those leaders who have been on the front line have done. So it's really important, I think, to our model to make sure that it's not just us, but that also we're getting other leaders into the conversation. And everything that we do is built around being very interactive and leaders learning from one another. That's probably the best part of it. You know, we're here, we're throwing some things out there for conversation, but really I think the best that people get out of it, and they tell us this all the time, is to one, feel like they're not alone in the
Mhm.
challenges that they experience, and then two, get some insight about how people overcame certain things, some ideas, maybe what didn't go well. Just learning from one another is so important when it comes to leadership.
Yeah, 100%. And I think it's kind of when we talk about those kind of good leadership or the role of good leadership in public health. I think the reason why, to me, that makes sense, or why it's important to understand that, is then the role of trust and psychological safety in the different, and it means different things in different environments, right? Like
Yes.
psychological safety in a hospital, the role that plays is very different to the psychological safety in a corporate space.
Yeah. Yeah.
Right? They're both
That's true.
super important,
Yep.
but the impact of psychological safety on one is a different impact on psychological safety on the other, right? It's like
Yeah.
one can be not feeling comfortable to say somebody's medication's wrong, and that leads to death. The other is
Yes.
not creating a space where their happiness is, or their teams are going to thrive, and
Yeah.
that makes a difference as well, right? So the next question would be around what can you do to create good leaders, but it's going to be important when you're creating those programs.
Yeah. Yeah. I'm really glad that you called that out, because it is really true for healthcare that when we talk about creating psychological safety, it is a matter of people's life in
Mm,
many instances, right? Like you need to be able to say, hey, I made a mistake or something doesn't feel right. So safety is important in a lot of industries, but in healthcare, certainly is one where it's exceptionally important in a clinical environment. So I'm glad that you said that, because it's true.
mm,
Not to say that it's not also equally as important in a corporate environment as well, that we feel free to be able to try things out, make mistakes, and without fear. That's important as well. It's just a little bit different.
mm,
So I'm glad that you brought that up. But yeah, so the way that we do it, again, so I mentioned that we're very focused on human centered skills, and so we do focus with leaders on identifying what their gaps and opportunities are. We do a lot of assessments with them. We do Enneagram. We do something called KELP, which is focused around um, our learning styles, but also are just the way we enter into the decision making process. That one's really interesting. We do a lot of these with teams, so that they can learn about each other. But
mhm,
also, I think it's great learning for the leader themselves to be like, oh, like this is why I function this way.
mhm,
Or this is what I'm going to need from my team. So we do a lot of assessments to help them. We do, 360 feedback to help them identify areas of opportunity. And then we have so many different modalities for our leaders, and we have to, because again, we've got some leaders who are working on the front line where they've got barely any time. They're not sitting in front of a computer a lot. So we have to make sure that we are creating a variety of different opportunities. So we do things virtually, we do things in person where we're getting people together. Sometimes it's cohort based, sometimes it's just a one off, depending on what the topic is or how robust the content is. We do what we call our leadership learning forums. These actually came out of the pandemic, and I think it's one of the coolest things that we do.
mhm,
So during that time, or before that, everything was being done in person, and then we switched everything to virtual. And we just took a pause on all of it and went to our leaders and said, okay, the world is crazy. What do you need from us right now? We're not going to tell you what you need. You tell us.
mhm,
And this is what we came up with, which is this model where it's always virtual. Any leader at any level can come to these forums, and it's around a specific topic. And we get those topics from our leaders, like what's important to you right now. And it's
mhm.
very interactive. Again, this is that opportunity for leaders to come together and talk to each other learn from each other, and it'll be around a specific topic. So just to give you an idea of what those might be, it could be something that's very focused on the leader, like focusing on what you can control, setting healthy boundaries, how to manage up, how to get support from the leaders above you, things like that. Or it could be a little bit more outward focused of how do you build trust on your team? How do you build psychological safety? How do you build a really great culture for your team? And so we do those as quick hits. We offer them a lot so that people can come at different times. We repeat them and continue to come up with new topics as needed, as situations arise and people talk about what's important to them. We also create videos in house, really quick ones, 3 minute. We have a podcast, which I host. We started that about a year ago. People have been loving that because, again, that gives them that opportunity as they're driving home or wherever it might be that they can listen because it's audio only. So we just try to come up with a lot of different opportunities to really meet people where they are. And then I mentioned coaching as well. So we want to make sure that if people are going to these sessions or if they are utilizing a coach, that there's things that they can do in between when they need it, when they feel like, hey, I really need something or I want to continue to practice these skills. So just creating a lot of opportunities for them.
Yeah, sounds like a lot.
Yeah.
There is a lot there. I'm trying to figure out which question
I know
asked off
it's
the
so
back
much.
of all of that. I mean, I'm guessing what's been the peer-to-peer learning. It sounds like a
Mhm.
group sessions you
Yeah.
have off the back of the learnings. I can imagine that kind of brings out lots of different challenges, and I guess that leads more peer-to-peer learning. When you think about it as a whole, what do you think is creating the biggest impact?
Yeah. So again, I do think it's the opportunity to learn from one another. And I
Mhm.
say that because you could do this with no money. Like we're investing pretty heavily in it. We're a big company. We need to be we have to. But if you're a smaller organization or if you're just not that well resourced, you could honestly just bring people together, bring leaders together in a safe space, probably with someone facilitating, but that could be anyone, and just utilize content that already exists. Grab some really great podcasts that are out there or a video or you could do like a book club, something of that nature, article club, something where people are looking at the great resources that are already out there and then just coming together around that topic and throw questions out and allow people to interact, because I feel like that's the biggest learning that they get is learning from one another. So I would say that along with coaching. Coaching is really powerful because it empowers the leader to figure out their own solutions to whatever it is that's going on, because it's usually something deeper than probably any of us could tell them of, what to do. You can give somebody an idea, but oftentimes it takes some looking inward and really that empowerment for the leader to figure out some solutions on their own. So I think coaching is really impactful in doing that. And it's interesting. We actually were recording a podcast yesterday about coaching, and it was making me reflect on my time in wellness where we did health coaching. And I feel like it's very similar. When I was functioning more in my role as a dietitian, people would come to you and they're like, I just give me my meal plan. Like just tell me what I need to eat and I'll eat it and then it'll be great. And that's not
What?
reality. That's not empowering at all.
Yeah,
It doesn't reflect on anything that you might be dealing with from a stress or mental health standpoint that might be influencing your food decisions, which is usually a lot,
mhm.
or just your life and what you've got going on. So it's like I can give you something and you can try and follow it, but it's probably not going to be sustainable because it's not actually helping you to look inward and think about
Creating a
what you actually
lifestyle.
need.
Yeah.
Yeah. And I think that's true in leadership. I think it's very, very similar, which is why I think coaching is very effective for leaders as well. It's a different topic, but it's very similar where you really want people to feel that empowered feeling. And so it really helps to do that. And it's kind of nice, I think, because our whole team is trained as leadership and executive coaches. So we work with an external vendor to get trained, but we use our own people to be coaches. And I think that that's really helpful because all of our development that we're doing is being created and delivered by coaches. So
Mm.
we kind of take that lens when we're working with people, whether it's a coaching engagement or whether it's just another type of session. We have that lens all the time.
Yeah. Yeah, you don't need to praise coaching. I know the benefits of coaching is great. I bet, as you said, if people don't understand what coaching is, then they not knowing actually the empowerment and the motivation from self
Yeah.
and figuring
Yeah.
out what the journey is and the right things for you to do. I kind of always explain coaching when I do my introductions to people in our first coaching session is I can't tell you to go for a run, or I can tell you to go for a run. Are you going to be as motivated if you figure out actually the best thing for me to do is go for a run? And
Yeah.
it's the same for coaching, right?
Yeah.
If you figure out that journey and figure out what you need to do. But with leadership, there are going to be some elements maybe you don't understand, whether that's management styles and the way that some people need to learn. And that's where
Yeah.
I'm interested to see what this KELP
Yeah.
program is about, because that sounds very similar to Insights or Gallup Strengths, and how that impacts and how that educates leaders. So there is a role for education, and there's a role for, even in coaching,
Oh, yeah.
advice or information. It's
Yes.
done in a way that allows them to go, okay, I just have to work really well with this, the way I'm going to do that.
Yeah, I mean, and we do that. We provide resources all the time. I mean, you certainly can do that. But I think you're spot on with your analogy in the wellness world because it's very, very similar. Yeah, and what works for one person in wellness and in leadership doesn't work for somebody else. You got a different team, you're in a different environment, you're a different person, you're working with different people. So you can share ideas, and that's really useful. And a lot of the time, it will be beneficial to hear what other people are doing, but ultimately it does help even more for that leader to come up with, hey, okay, knowing what I know about myself, knowing what I now know about my team, this is what might be something that I want to try. And then, yeah, and then you get that empowered feeling of like, I came up with this myself versus, because if you give me an idea and it doesn't work, then I'm probably just going to write you off and say, oh, he doesn't know what he's talking about. That didn't work for me. But if you empower somebody, it's just so much more beneficial.
Yeah, agree with that completely. But I think this all comes from a starting point of engagement, like you were saying, all these great things, and I said, and if you said about you could do all of this without any money and any investment, which some of it is true, and I agree with you there. But you're going to need someone to facilitate it. You need somebody to look
Yes,
after
it
each
probably
element.
needs some money, but you can do it more minimally than you think, I guess is my point. Like you don't necessarily need to go get a big
Go
fancy
crazy.
vendor if you can't. Yeah, you don't have,
It does
not in the
help.
way that we have. Yeah.
It adds a benefit. But
Mhm.
I guess where I was leading with that is there is an element of engagement. So you get all these people who come to these workshops, and you've got, as you said, you've
Yeah.
got 1,700 leaders, not including kind of team leads, supervisors. You're not getting 1,700 people to these meetings every single time.
Nope.
So the ones you do get are engaged.
Yeah.
How do you engage and get the other percentage of people who aren't engaged?
Yeah. I mean, and isn't that the question for anything that we're ever trying to do, whether it's a, wellness, well-being world or leadership development too. I will say nothing that we do is actually mandatory, which I think is kind of interesting. It's strongly encouraged. But I feel like there's a couple different things that you can do. So one is that we do have metrics, things that are tied to performance reviews, to bonuses, to say that are related to culture and engagement of people.
Mm.
I think that's really important because we need people to see like, hey, if you're struggling, you know what? There is a lot to support you if you make the space for it. And also make sure that leaders of leaders are helping to create the space for it. Our leaders need to know that they can participate, that there is room for them to do that, which is really important that we're also working with our leaders of leaders
Mhm.
to prioritize this for their people. So I think that that's one thing that's really crucial is to make sure that our leadership competencies and the things that we want our leaders to be doing, the behaviors that we want them to emulate, that is tied to how they're being rated in terms of their performance. And again, with bonus structures or however it is that you're rewarding people, I think that that's an imperative.
It's
I
a really
also,
interesting, it's a really interesting thing to do there, rather than just focusing on KPIs, which which are on business output,
yeah,
to actually focus on maybe some things which aren't as tangible, and it's done by survey, it's done by culture.
yep.
When did you implement that, and what's been the impact of that?
Yeah, that's a good question. So I feel like that's been part of our performance management for a while. So I've only been on the team for about a little over a year, and we've been doing this work for much longer than that. So I don't want to speak if I'm wrong, but I would say it's been there as far as long as I can remember, so at least several years. But we've definitely been seeing great impact. I wish in healthcare or at least in our healthcare system, we had more robust analytic capability around our data so that we could investigate some of this further to show the impact. But we are becoming more and more data driven and starting to look at some things, and we have seen some things that I think are pretty cool. So the first thing I'll say is that we do, as you would expect, pre and post surveys for our programs. So what I like about the way that we do it is it's not just for the leader, but we also survey their leader, their one up. So we want to make sure that it's not just the leader saying, yes, I improved my skill. I feel like I'm better equipped to do XYZ, but also that their leader is saying, yes, I have seen an improvement in this person based on their engagement in this, and not just immediately following, but 6 months after seeing that impact. So we have seen statistically significant improvements in leadership capability 6 months out, both by the leader and their one up, which I think is pretty cool. Also, when you look a little bit more system wide at our engagement survey, there's two things that I'll share. One is that because what we do is not mandatory, we did look at those leaders who engage most with our initiatives and found that they all rated in the top 15% for engagement survey scores. So they are outperforming other leaders if they are engaging heavily with us, which is awesome. And then one particular question I always like to call out from our engagement survey that we saw an improvement on. I think it was over the course of 2 years, which we only have back to 2023 data because we actually just switched vendors for our engagement survey. But when you looked at the previous 2 years from 2023, we saw I think it was a 6% improvement, and we rated 6 points higher than the national healthcare average for this question, which is my manager cares about me as a person. And it sounds like a fluffy question. And I would say if you're talking to some top level executives, they might be like, what? But there was actually a really big survey that was done. I think it was with the Workforce Institute, I believe. They did a really big survey. It was I think it was just in this country, but it was across multiple industries, and they found that the number one criterion for retention was feeling like your manager cared about you as a person. Like that was number one to people. So it sounds a little fluffy, but it actually has real business impact. So we're really proud that we've improved that for our people, and also we're higher than the benchmark for that
Yeah.
question.
I think it's very similar statistics that we have over here as well, in regards to like the impact of management caring about them.
Yeah.
What's interesting is if you ask the leaders in regards to do they feel like they are providing that, is a very different response to the potential people who maybe
Yeah.
who actually would give you the correct score, right? Or the employees or team members. I guess I don't know whether you have this statistic. Are you seeing a big difference from that 15% who are engaged from a standpoint of the cost to the business? So
Mm.
retention, from time off sick, from output, are you seeing a correlation between those 15 people and the rest of the companies who don't, like, the people who they're managing, are they outperforming the people who aren't in
Yeah. And that's the kind of data I wish we had. I, I wish we did. And I've been talking about it a lot with my team. I'm like, oh my gosh, we need an analyst devoted to this because I would love to look at turnover for the team, for how performance engagement. I mean, it would be really great to dig into those numbers a little bit more and see what that looks like across teams. So we're not there. I would love for that to be the case because I do think it could, hopefully it would show that. We'd like to think that, but we don't know. And it could tell us something that maybe we need to be doing differently or thinking about differently if for any reason that's not the case. But hopefully that's true, but I can't say for sure.
Yeah. Okay, then I'm going to go back to, you said you don't make any of this mandatory.
Mhm.
If you could, yeah, first, why, and then if you could, what would you make mandatory?
Mm. Yeah. So for the question of why that we don't, that I don't know. I think part of it is because we really want our leaders to prioritize this. Like we want them to not feel like we're making them do it, but like this should matter to you. And I think again, to tying it into performance management and stuff, it's doing that without doing it. But we're not actually, not checking to make sure that they've all done it. But it says something if you do or you don't. And there are eyes on that. So I think it's sort of a way of doing it without having to be as heavy handed as mandatory training. So I think that's why it's like you're in charge of your own development, you do this. As far as what I would say that people should, I think they should do all of it. I know that that's not, that it's not, it's not possible, but I think that there's some different, we have some programs that are really designed for like, if you are becoming a people leader for the very first time, here's what we think that you would need for that. So we kind of give them a little bit of a roadmap. But I will also say this that I think is really important. You can't stop getting developed as a leader. I saw some
Human, I
really,
think. I think
and
as a human, I think putting a title just on a lead, I think as a human being, you can't stop
yeah,
developing.
yes,
We need we need
yes.
mastery in our life, right?
Yes. But part of the reason I want to say that is because of some research that I saw that was so interesting. And it was specifically around emotional intelligence. And emotional intelligence, I will say, it's like the foundation of everything that we do. Like this, it's an imperative. And I saw a graph from someone who does a ton of research on emotional intelligence that she shared. And so it showed that as you move up into like a manager level role, your emotional intelligence tends to go up. Like as a collective, that's what we see. But then as you look at director level, VP, executive down to C suite, it just continuously goes down. And the speculation around that was that, well, one, we sort of promote people for like short-term business related outcomes, their successes, but not necessarily their ability to develop people. It's more around those business objectives. And then also as you get higher up, people become more reluctant to give you the feedback that you need, or to tell you more about what's going on in the front line. You spend less time with people working on the front line. And so with that said, the most successful people in any of those roles are highly emotionally intelligent, but just as a collective, it tends to go down. And so I think that that's something that we've been thinking out about a lot because we do invest a lot more in the frontline leader.
Mhm.
It just kind of happens naturally. I think when people come into that role, they're like, I need to learn. And then somehow it starts to drop a little bit. It's like, oh, you don't really, I mean, I think clearly this is needed because now you are also charged with taking care of and supporting leaders of people. And so we can't forget about that. And so I just wanted to call that out, that I think for us, something that we are prioritizing more and more is, okay, so then how do we both support and develop our leaders of leaders, so we can make sure that our managers, what they're experiencing, the culture they're trying to create for their teams is matching what they experience from their leader.
Yeah.
Because if those two things are in conflict, that leader's going to struggle, and then their team's going to struggle. It just doesn't really work.
Yeah, culture starts from the top, right?
Hmm.
Yeah,
Yeah.
I think that's a really good observation and a really interesting one you make. You have to share. I think you have to share that graph and that
Yeah,
information in the
sure.
comments after.
I'll find it, because it was, I
Yeah,
mean, I've been sharing it with everyone because I'm like, this is so interesting. We need to do
yeah,
something about this. Yeah.
yeah. So I think companies take two approaches, right? They either spend their money, invest, depends on the size of organization, those top C-suite executives.
Yes.
But as you said, sometimes because they're level, they don't get the honest feedback, or they aren't as purposeful in their leading. They're more purposeful around their performance. But then, or they go for that kind of lower level or frontliners, new managers, trying to get them to learn how to be a leader. But
Yeah.
actually, they're both vitally important. And spending time, if you've got lots of different people, that's where the culture and the environment starts.
Yeah.
And then the one's also kind of pushing that pressure on the middle ones below. So yeah, I think that's a really kind of good point. And I think that's where your psychometrics about personalities
Yeah.
can come into it. This kelp
Yeah.
thing you talked about, there'll be really
Yeah.
interesting one.
Do you want me to
Uh,
tell you more about it?
yeah, go on. I'm just worried of time, but go on, give me
Okay.
a little bit more.
Okay, I can give you a quick rundown because it is so interesting.
I
So
love this.
there's different ways that we enter into the decision making process. And so you're going to have your people that are very focused on creating the ideas.
Mhm.
Your idea generators are like, I got a great idea. And then you've got your people kind of slow down the process. They're worried about, how is this going to impact this person, this person, this person. And then you've got your people who are really reflective, your analyzers. And then you go into your people who just like to make decisions. They want to move real quick and making decisions, and your people who want to act. And it's this cycle. And honestly, whenever we're making decisions, we all kind of move through the cycle. But what this does is it talks about where you default in. And when you think about teams and the people that drive you crazy, it's usually people on the other side of this
Okay.
cycle, right? Like, it turns out I'm a decider. I like to, like, let's get to the decision. So those people that are slowing things down, like, oh, that's why you drive me nuts.
Yeah.
And so when you start, if you think about a team and you do this assessment and you see where everybody falls, it can help you to understand why somebody might be triggering you. It can help you to figure out who you should lean into. Like, if you're somebody who likes to act really quickly, probably a good idea to go spend some time with your analyzers and your reflectors to make sure that we're not forgetting something, that we're not charging forward and not going to make a big mistake. So it is so powerful. I've been facilitating it quite a bit lately, and I feel like teams get so much out of that.
That's
That
very similar to have you heard of insights?
No, I don't know it. I'm sure our
Yeah.
team probably does, but I don't.
It's a similar kind of thing, right? There's four colors, and the colors are,
Okay.
you got your reds, who are your decisive people who want to get stuff done really quickly.
Yeah.
Yellow, which is like involvement. They like to be involved in these decisions and feel left out if they're not involved. You got green, who needs to be shown they care, just wanting their emotional support, I guess, as well. And then you got your blues, who are your analytical numbers, data, stats.
Yeah.
So it's
Yeah.
very
Yeah.
similar.
Very similar. I think it
That's
just breaks it down to more categories, but yeah, very similar. It's so
yeah,
helpful for
I
teams.
love it.
Yeah.
Look, where are we? What, 45 minutes already? Look, we've spoken a lot about kind of leadership, some of the cool stuff you've done, some of the impacts of all of this stuff. I guess I have one more kind of thing to discuss. When we spoke last time, and then the kind of notes we've shared, there's a term you used and I want to kind of get you to explain why this is important, I guess. And
Okay.
the term is leading self over leading others. So when
Mm.
you're doing leadership training, you're getting them to understand the importance of self. But tell me
Yeah.
why what you do is special, and then kind of the impact of that.
Yeah, so it's a couple things. I think we've all heard, maybe we use it a lot, that you have to put your own oxygen mask on first
Mhm.
before putting on others. And I think that's in healthcare, we understand that, right? You've got a bunch of people that probably are very care like have a very caregiving personality, right? Because a lot of our leaders came from frontline roles, they got promoted into leadership. So we tend to be sort of naturally compassionate and caring about others, which is awesome. That's really great that a lot of our leaders that have come into this from that standpoint. But you also have to make sure that you're taking care of yourself. And we see this time and time again, especially when people are coming into the leadership for the first time. They just want to help everybody. They want to jump in and do. And there's some hard work that comes from looking at yourself and saying, okay, but what is my role now?
Mhm.
What do my people need from me now? And so that's when we start talking to them about things like setting those healthy boundaries, focusing on what they can control,
Mhm.
identifying what their gaps and opportunities are, which might be different from what they even think they are. So, doing things like 360 assessments for them to learn what it is that they could be doing differently, where they might be having biases. I mean, that happens a lot again as you're getting promoted into leadership roles. So, it's really having a good, solid understanding of yourself, of where you need to work, where you need to grow, and making sure that leaders are prioritizing that before jumping in and starting to look at, you know, like, how do I create this great culture for my team? That is, of course, important, but you have to look at yourself first. So, honestly, even when I talk about like our forums that we do, almost all of them start with the leader first. And then it's like, okay, now how does this apply to your team? How can you support your team in doing this too? Um,
Mhm.
and even, you know, something like setting healthy boundaries, I think is a great example. You need to be able to model that. Like you need to be able to modeling that is how you are supporting your team in this, because when they see you do it, then they know it's safe and you're
Mhm.
showing them how. So that's what we mean when we talk about leading self.
Yeah, I think I had Sam Harvey on my podcast recently, and he talks about leadership being two parts. And
Okay.
this will stick with me, I think. But leadership is leading people
Yeah.
as a manager, and there's also
Yeah.
leading by example. And I think that
Totally.
fits so perfectly, right? You have to lead
Yeah.
by example. But when you're in the industry, and that's, I guess the second point of all of that is from you were saying beginning, when you have people who are passionate about people and wanting to help people, they're sometimes the worst people to put themselves first, right?
Yes. Yeah,
Like parents,
exactly. And
mums are the worst to put themselves first.
and I always make the comparison to parenting. I have a 5-year-old myself, and I feel like there's a lot of similarities when it comes to parenting and leadership. There really is. And I've learned that more every day. One thing that I talk about a lot is, and why I think we need to have compassion and empathy for leaders in the role that they have, is because if you are struggling, it's impossible, even if you are so well intended and you know what to do, you're probably going to default into what you've experienced. And this
Mhm.
happens in parenting. It's like, wait a minute. I hated when my mom did that. Why am I parenting like this? Why am I doing that? And the same thing happens in leadership. If you are overwhelmed, even if you're, again, well intended, wanting to do things differently, you're going to start to just default into what you experience. And so the better leadership experiences we can create is going to make it's going to have that ripple effect, that trickle down to where the default needs to be compassionate, empathetic, human centered leadership versus that, you know, command and control that a lot of us experienced early on in our careers. So, yes, parenting and leadership,
I
so many
love that.
similarities.
Maybe that's the second topic. Maybe that's the second podcast.
Yeah, maybe we can dive more into that.
We'll compare. No, maybe you won't do that. Maybe you'll save it for a different podcast, not the Wellbeing
Yeah,
chat.
maybe.
Bridgette, thank you. I've really enjoyed this. There's been lots of really interesting kind of bits from this. But before I let you go, I want you just to share your top 3 bits of advice for someone in kind of a similar situation, maybe who's got a bit of a role for supporting leaders. Not everybody's as lucky as OhioHealth to have their own leadership-focused team, and someone like yourself.
Yeah.
So if there's a HR in an organization or some learning and development, what is the key top 3 bits of advice you'd give them?
Yeah, so it's a really good question to ask, and I feel like there's a lot of things you can do, but I would say again, I kind of mentioned this earlier, but it doesn't have to be a huge financial investment to sort of take this stance that we are going to support and develop our leaders. So get your leaders together, create safe spaces for them to talk. uh, you can't just send people off into leadership roles without giving them support and development. So, whatever that looks like for you, however you can, however you're able to invest in that, find a way to do it. And I think one of the best ways is, again, to get leaders together to be able to connect with one another, make sure that they have the space to do that, make sure that it's coming from the top, that this is something that we need to prioritize, that leaders have that opportunity to connect. So I would say that that is number one. Number two, I think it's also really important to think about the other initiatives, strategies, things that you're working on as an organization and figure out how to fit this in. A lot of the time, I feel like leadership development sort of fits into this like siloed thing. But there's so many connections to uh, initiatives around safety, around recruitment and retention, around DEI, around wellness or well-being. There's so many connections to that. And so think about how you can fit this in to some of those initiatives, especially if you're wanting support for it. What is your organization working on? What do they care about right now? You can find a way. If you can't, reach out to me, ask me, I'll help you, I'll get you the data. Because there's so much data to show the importance of this and where it fits in. So that will get you the support if you don't feel like you have it. It's like, what is it? Because I guarantee you there is some kind of data to show why it's important, whether again it's around retention or engagement or productivity or safety or even like customer service or corporate social responsibility. Like there is impact when you focus on leaders, and also you get a ripple effect with leaders. So it's a smaller group, but you invest in them, and that means you're investing in everybody, right? I say that all the time. I'm like, if we do a really good job with 1,700 people, we get to impact 35,000 and their families and the patients and the patients' families. It is huge. So think about that. That'll be my last one. Think about that ripple effect when you're trying to get support for doing this. We cannot, even in healthcare where we are patient focused, we can't be patient first if we are not taking care of each other. It can't be patient first while our people are being harmed. So we have to take care of one another.
Yeah, I love that. You kind of even ended on a sales pitch for me as well.
Good.
Thank you. That wasn't planned. I promise everybody that wasn't planned. But look, thank you ever so much for joining me, and then providing such a perfect sales pitch for employees' health and the high performance coaching stuff I do. But well, that wasn't meant to happen. Everybody, yeah, Bridgette, I hope everybody else enjoyed that. I look forward to getting this live and seeing what everybody else thinks. But in the meantime, thank you, everybody else. I will see you all soon. I hope you all enjoyed it. If you do want to reach out to Bridgette, what's the best way to contact you? Probably just via LinkedIn, I'm guessing.
Yeah, I'm very active on LinkedIn, so feel free. I love connecting with new people. So check out what I'm posting about, send me a message. Happy to connect.
Love it. Brilliant. To everybody else, have a lovely weekend. It's half term over here in the UK, so enjoy it, and we will see you all soon. Take care.
Thank you,
Bridgette,
Rich.
stay where you are. Stay where
Thank
you
you.
are.
Okay.